Hi there, and thank you for joining UnSCRIPted. I'm Angela Kashuba, Dean of the UNC Eshelman School of Pharmacy. We have an amazing community here at the school, all working toward a shared goal of solving the world's most pressing healthcare challenges. I'm excited for you to hear unscripted stories of our faculty, staff, students, alums, and partners. Today, I have invited Phil and Jo Ellen Rodgers to my office for a conversation. Phil is Director of Interprofessional Education and Practice in PACE, and Jo Ellen is Vice Chair of Professional Education and Practice in DPET. You are both very beloved at the school, and so I'm very excited for you to be joining me today. Thank you so much for your time.
Good
to be here.
Thanks for having us.
I want to ask you a question about how you met, because you are fondly known as Mr. and Mrs. Dr. Rodgers,
Right.
Yeah.
and you met here at the pharmacy school. Would you tell me that story?
Yeah. It was Bill Sawyer
Yep.
and Hayward
Yep.
Hall's course.
The statistics course.
Yeah.
And so we basically met on the first day of me coming back to PharmD school, and Jo Ellen was taking a couple PharmD courses as a BS student.
Mm-hmm.
So we met on the first day of the class, and one of the first things that we did was Bill Sawyer had us, as a professor teaching statistics, to collect data on something we could use for the semester, had us the whole class, of course, it was only like 15 or 16 people at that time, but we went to the basement of Beard Hall, and we all ran up the stairs as fast as we could, and he timed all of us. 4 flights of stairs, all the way to the top of Beard Hall. And he timed us, and then we used that data on statistics like associations with our age and our gender and things.
Whether we had coffee that morning.
Yeah, whether we had coffee that
what our
morning.
GPA was.
So we kind of met at that point,
Standing in the basement, waiting our turn to run up the stairs.
Yep.
I love that. And running becomes a theme.
Yeah, right. Yeah, we were running. We were definitely running up the stairs, and then soon at that time we had physical keys for the building, and only PharmD students were given keys to the building. The BS students didn't have keys.
He had a key. I did not.
So I had a key, and so she was
a little sly.
A little sly. And she said, I need to get into Beard Hall to get what was it? Something on the
work on the computers, because only computers had SAS. To do the homework.
And so she was like, "Can you?"
That was Labor Day weekend.
So we can get in the building.
Yeah, I remember.
Yep. So I was like, "Okay, sure." So I let you in the building, and we hung out, and then we went to lunch, and that was kind of our first informal date.
I really had already done the homework. It was done.
Yeah. She didn't. She was like, "I don't
need to
do something here. Make it look like I'm working."
I love it.
Yeah.
That's great. That's a great one.
Yeah.
Thank you for sharing.
Yeah.
So you are both alums of the school, and you have been faculty at the school for a long period of time. Can you talk about how the curriculum has changed and how the profession of pharmacy has changed since you've been in school?
Yeah.
I'll let you start.
Okay. Yeah. The curriculum is trying to address the new jobs. I mean, there's so many evolving opportunities for pharmacists. Some jobs look a little the same, but continue to evolve. Certainly the role of the clinical pharmacist has changed a lot in the last several decades, and will continue to evolve as our healthcare system changes. But new opportunities, data analytics, the role of the pharmacist as an investigator, both in academic but also industry. We are well positioned as a profession to lead research, but also to lead evolution of the healthcare system and how to best meet our patients' needs through telehealth visits for patients in rural community settings who can't get advanced health care, but also disseminating what our best practices are to the more community and rural hospital and clinic settings. Yeah.
We were just getting back to the pharmacy school at the time when the All PharmD program was taking off here. So that was something to see as far as that evolution, and then living through the curriculum transformation around in 2015 or so, and being part of that was neat to see how we could forward pharmacy education for the for the next group of students coming through.
Yeah. What do you think was the most important change that we made in our curriculum during that transformation period that's really created impact for our students?
Yeah. For me, I would say it was the higher touch in the experiential area and the interweaving of experiential into our didactic curriculum, so that students were getting an impression of how to apply the different types of things they were learning in the classroom, immediately being able to apply those into practice. That, I think, was made the program so much more patient-centered, in addition to the way we were teaching students in the classroom as being more problem-based.
Yeah.
Right. But also a heavier focus on the soft skills, leadership, advocacy, patient, clinician, having crucial and challenging conversations and situations, how to deal with those. I don't know that was as emphasized, or that was definitely a bigger emphasis in the new curriculum.
You both were highly involved during your time as students and now in pharmacy fraternities, right? So Kappa Psi for you and Kappa Epsilon for you. So can you talk about why that was important to you as a student and why it continues to be important to you as faculty and mentors of our students?
Early in college, I did not consider myself to be interested in fraternities at all. The early part of college in Greek life just wasn't for me. So I actually surprised myself when I got into pharmacy school and got, highly interested in Kappa Psi for me. And it was that sense of it was camaraderie. It was also a sense of going through the same experience together with others in the professional program at that time, of the BS program. And also to have that kind of social nature to it. So it was to me, it was an ideal blend of the social and the professional side, to have connections in the profession that you can kind of relate to as being part of an extended brotherhood, so to speak, in that way.
Yeah, and we mentioned kind of networking internally, but also with our alumni. The students get really invigorated when the alumni want to come back and connect with them and share stories of their memories of, certain professors and experiences. Oh, we used to do this service activity. And actually the students are like, oh, we didn't know that, but that sounds like fun. Let's do that. But also networking when people are looking for additional training and jobs. That's a great service to those organizations and our learners.
Right. It's an immediate and quick connection that the student can make to an alumni that they don't know. It kind of facilitates that interaction from the outset.
Right. Yeah, really important. I appreciate you both for providing that mentorship to these organizations. I think it's really important, and the students just love it. So, Phil, you direct our interprofessional program, and I'd like you to talk about interprofessional education and practice and why it's important, how we teach that to our students, and what the future looks like. Yeah.
So it's important to us as a school because we're held to an accreditation standard that says we have to do it. But it is important because one of the reasons I'm inspired about interprofessional education is because, I saw it was such a vital part of the early part of my career. I was never practicing as a solo practitioner. I was always surrounded by physicians, nurses, social workers, dietitians. I practice in the field of, particularly in diabetes management, and there's so many professionals podiatrists, ophthalmologists, and so forth that have to be involved with care of those patients. And so I was living that life of being a part of that interprofessional team from very early on. So, but in pharmacy school at that time, there was very little touch that we had with other professions. And so I didn't really get the chance to get involved with other professions in school until I got out into practice. And so it shows me that, we can get students prepared so much more early about learning the roles and values of other professions. And so that's the standards that we've set in our curriculum, is to build students through a developmental program, so to speak, of learning how to interact with other professionals, learning what their value is, how to show your value to those other professionals. And so we build that through the curriculum at our school, starting in the very first month they're here, basically, and giving them lots of interactions with students from the School of Medicine and from the School of Nursing and all of the other School of Dentistry, uniquely enough, right? And so we try to build in all these opportunities, because as students get more used to being around those other professionals, they'll know, what they can contribute to patient care. They realize the pharmacy students are not an island and the only people that are contributing to the care of the patient. And so better learning that, as well as learning to be better team players, which is an important ideal of our school, is to make our students team ready when they graduate. And so we build that all the way through into the experiential curriculum and make sure that they're experiencing good interprofessional teams in the experiential space, so that when they get out, they know what their place is in the care of a patient, but they also know that they're valued by other professionals. And that's very, very important to having a good well-being in your career, because you feel valued.
Right.
Yeah. So
that's tremendous. Thank you for your work there.
Thank you.
So, Jo Ellen, you are currently president of the American College of Clinical Pharmacy. Congratulations on that.
Thank you.
Tell me what you would like to do this year during your presidency.
Yeah, I do think we need to think a lot about our colleagues, and I know this is an important area for our school and many schools across the country, about the needs of our pharmacists who are working in community and rural areas, and how we can best support them and advance what they're doing, so our communities are better supported and the care needs are met. And one that might speak to you, kind of reimagining the role of the pharmacist as the principal investigator. And you as a PI on many studies. I mean, this has been going on for decades, but I don't know. I think about I think when people think about pharmacists as PIs, they all think academia, but and there's certainly more collaborative research, and more nowadays individuals are co-PIs, sharing it with their physician or nurse collaborators or other healthcare disciplines. But what about all that we're doing to advance medicine? People who are designing trials who are not in academic environments, same job, just a different environment. So I want to make sure that our students, our learners, and even pharmacists who are out practicing are aware of all the opportunities, supporting career transitions. Phil mentioned well-being, supporting well-being. So there's a lot of initiatives I'm very, very excited about, and they touch practice, but also, positioning pharmacists and advocating for pharmacists and our role in the healthcare system. And I could go on an entire afternoon.
Well, those are terrific.
Those are just a few examples. Yeah. Thank you. Yeah.
I'd like to bring it back to running now to wrap up. So you met running up and down the stairs, and you continue to run. So talk about what running does to help in your daily life and why you continue to run.
I tend to do, longer distance running, right? And there's great lessons about adaptability and persistence and endurance that to me translate into life lessons that I tend to carry forward. So maybe that's a bit meta of me to say that, but that's one of the things I get out of it. And being able to run with some friends here and there, but also enjoy running by myself and just kind of, just being my own headspace. Exactly.
Yeah.
It's great.
Yeah.
Yeah.
That's when Phil gets through a lot of his podcast lessons too.
Yeah. Definitely a podcast fan.
Working in cardiology, you would think at the top of my list would be being heart healthy. But I guess it's different approach to health. Running certainly does a lot of the same things for me, but it is kind of like my social time. I'm very much a social runner. And so, I don't have time in my life between work and family to meet a friend for a cup of coffee. So let's just meet and go for a walk or jog or run and connect there. And I have found that to be a great source of support in my life and in a way for well-being as well as heart health.
That's terrific. Community connection. That's stupendous, I think.
Yeah.
Well, I want to thank you both for spending some time with me. This has been a really great conversation. I know we could go on, but it's been really wonderful to hear your journey and to hear the things that you're currently doing as faculty in the school. And I just appreciate you both.
Thank you.
Thank you.
Thank you so much.
And I want to thank you for watching. We love sharing stories of those who make the UNC Eshelman School of Pharmacy excellent. We hope you will join us for the next episode of UnSCRIPted, conversations with the people who are advancing medicine for life.